Yeah, what is your approach if one is going to start TRT but might later on want to have children? Freeze sperm in advance, and what fertility protocol do you use?
Okay, yeah. So this is actually a question that I ask all of my guys that are, less than 40, because most of the time, by the time we've got to 40 as a guy, you've probably thought about, or maybe already have children. Not always the case, but one of my first questions when I'm doing my initial consultations is, do you have plans for family, or do you have children already? If they don't have children, but they do have plans for family in the future, then I obviously counsel them on the fact that TRT monotherapy in particular will cause a shutdown of fertility due to the break in the hypothalamic pituitary gonadal axis, or the suppression of that. And this is something that I don't labor too much. You see people hammering it, like going, oh, using it as like a sort of a stick waving thing, like saying it will make you infertile, and sort of almost threatening guys. And you see it on social media, actually. I know Dr. Winge that you spoke with recently just did a sort of a breakdown of an American doctor that was saying all that stuff, like Dr. Mike, I think his name was. And yes, it does, but what that isn't supposed to be used as is a scaremongering tactic, because these things are actually easily managed. Now, there are a number of ways we can preserve fertility. Now, the intercurrent use of human chorionic gonadotropin, or HCG, is a way of doing it, and it's a way that you do see a lot of people doing it. You can use other things like selective estrogen receptor modulators, like or SERMs, they're more commonly known as, like Clomid or Nolvadex and things like that, to try and keep that pituitary function going, because it's the combination of follicle stimulating hormone and luteinizing hormone mimicry via HCG that will continue to stimulate the Leydig cells in your testicles to produce intratesticular testosterone. And without that, you can't actually produce or finish the production of sperm. Myself, clinically, I don't labor this sort of like, you must have, if you want children in the future, you must have HCG, because I've seen guys on TRT monotherapy have children. So it's not an effective contraceptive. Like, just remember that, guys. So I don't think you need to hammer it home saying you must use. And I'm certainly not a fan of starting people immediately on HCG and testosterone at the same time. Because I think that's something that if you want to add it in to see if it adds benefits to their therapy, it's hard to do that when you started it from the beginning. And if they have negative treatment effects, you don't really know which one was doing what. But yeah, certainly theoretically, there is some evidence that HCG use intercurrently with testosterone will or can contribute to preserving fertility. But I think it needs more study, because I don't think it's as simple as how I've broken it down. I think there's a massive interaction with the CAMP messenger system, or cyclic adenosine monophosphate, and how that interacts with dopamine, and then so on and so forth. I know Dave Lee's he's a big fan of the neurosteroid synthesis pathways, and we could talk for hours with him about that. But myself personally, if a guy wants to start TRT monotherapy but does have plans for family, I will tell him about the option of HCG intercurrently, but I will also say that we can actually use other means. So you can use things like recombinant FSH, which is injectable. There's brand names such as Gonal-F, which is like follistatin, which is interestingly, a bit of pub trivia, is derived from the ovaries of hamsters. Yeah, not a lot of people seem to know that. So it's something to bear in mind, especially where I work, where there's large religious communities that maybe don't tolerate sort of animal products. But you can use large doses of that, and you can intercurrently use other SERMs like raloxifene as well is an effective one, because it has a slightly different activity pathway to Clomid and Nolvadex or tamoxifen. So yeah, there are lots of ways we can do it, and you don't have to be on HCG from the off in order to so-called preserve fertility. Yes, it will have a contributing factor to that, and I have seen that clinically. But I have also seen, like I said, guys on TRT monotherapy father children, and I've also seen guys using our specific fertility protocol that we do at Healand, which is a proprietary thing that I'm not allowed to say the details of, unfortunately, that have also gone on to father children. So it's there's more than one way to skin a cat when it comes to thinking about having children in the future when you're on TRT, and it shouldn't be something that should put guys off TRT that need it.
Thanks for watching. check out my new ebook Acne on TRT, links in the description of this video.